So physical activity and exercise have an important role in osteoarthritis. Moderate exercise appears to protect the joints from developing arthritis. So regular exercise is very, very important. But sudden high impact, torsional stress. So torsional is a twisting stress. So if you've got difficulty landing, you play a sport where you have a lot of change of direction, that also can increase your risk. High amounts of physical activity. So people who run a lot, 3 to 4 hours a day, may increase risk. So that's not going to affect everyone, although I saw a recent study that indicated a lot of this may be moderated by BMI. So if you have a high BMI and you run a lot, that's going to affect your risk versus if you have a low BMI. A low BMI, the risk is very, very low. So I thought that was very interesting. We also talked about this too, about the resistance training in youth, that if they do resistance training, that's also going to strengthen their joints. So, we definitely want that. And we just talked about ACL and meniscus tears, increased risk, especially in younger women. So management of arthritis, many people do pretty well on the NSAIDs or other drugs. Arthroscopic surgery may or may not be effective. It's interesting. There is a study that I've got posted on Blackboard about the pros and cons of physical therapy versus surgery. And the people who had surgery really did not do a lot better than the people who had physical therapy. So, interestingly, that the study was done in Canada, so there's no real incentive for people to undergo surgery for that. But eventually, if arthritis is severe enough, people are going to need either a partial or total joint replacement. So partial would be that the both parts of the joint are replaced, or a total joint replacement. But as we said, education, social support, exercise, particularly exercise that does not aggravate those joints, resistance training to strengthen the joints, weight loss definitely, and and the role of physical therapy, as we mentioned. So exercise testing. So depending on what symptoms people have, the cycle is good if their knees will allow it. A lot of people who have arthritis do take up cycling. Maybe they were a former runner and now they're going to take up cycling. So there are a lot of cyclists who have arthritis in the knees. 1 mile walk test, 6-minute, or the treadmill walking protocols. Look at their knee extension strength. So especially look at different legs. So compare the right leg versus the left leg. You can do 1RM testing. You may want to check flexibility range of motion with a goniometer. And then, of course, if you have people who are older adults, you may want to look at their balance and gait with the timed up and go test. Exercise and osteoarthritis, it's interesting that there really aren't a lot of data about that, because many people just eventually get referred for some kind of surgery. And so looking at exercise as a treatment is surprisingly inconsistent. So, resistance training, focus on the concentric phase of the activity, strengthening the quad. So you can see we've got lower repetitions here with a higher weight. Flexibility to increase joint range of motion. So getting people to be active and stretch multiple times per day. Water aerobics, of course, fabulous. Cycling, as we talked about, low impact walking, Nordic walking. That's what those little ski poles that you drag behind you, or I don't know if any of you were in class where Dr. K used those walking sticks. So that's a great way of, say, someone can't run, but they want to increase their intensity while they're walking, to use some sort of assistive devices. Watch for things like ankle weights. They can sometimes throw off people's biomechanics with their walking, and they may make arthritis worse. So they're not always necessarily a good thing. And kind of, goes without saying, watch out for plyometrics, and of course, watch for pain. If the exercise hurts them when they do that, then we might need to look for another alternative.